welcome to this episode of the Wagging Tails podcast. On this episode, we've got Dr Xutian. She's a certified fear-free vet with elite status, or an elite fear-free vet, who has joined us on the podcast to talk about the fear-free vet care movement and the fear-free pet professional movement. So welcome to the podcast.
Thank you. Very happy to be here.
So, Xutian, you graduated in Sydney with your first class honours and bachelor's in veterinary science in 2008. But I'm sure that that's not when you started doing the fear-free veterinarian things. So,
yeah.
Before doing that, do you want to tell us a little bit more about yourself? Obviously, we do know that you're a mother of two. You've got 3 rescue dogs and 3 rescue cats, and you're very busy both in and out of work. But do let us know a little bit more about yourself.
Okay, so basically, unlike many people who end up being a vet, I didn't really have that passion first up as a kid. So going through my teenage years, I didn't really know what I wanted to do. It made a lot of sense to kind of follow in my dad's footsteps, him being an accountant. So I actually did an undergraduate studies in accounting and finance first, worked a couple of years, but felt there was a gap and sort of a hole in my day-to-day life going to work. So at that point in time, a few years back from then, I did have my first ever dog. So my parents were quite firm and certain that they didn't want us to have pets so early in our lives. They wanted to ensure that we would be able to responsibly look after them. My first dog, which was a West Highland White Terrier, his name is Blizzard, had a lot of skin problems, and the local vet community couldn't seem to help him. And just something in me just felt that I feel I could do better. I would love to be able to put myself out there and serve others. And I discussed it with my parents. They were extremely supportive of this career switch. So I went into vet school as a mature student. I think there were a lot of benefits of that because I knew that this was really what I wanted to do.
Nice. So was there any specific situation during your earlier career that you decided that you wanted to do fear-free as a vet?
Okay, so the whole concept of fear-free, stems from understanding and acknowledging that our pets do have emotions. They feel the same sort of emotions that we do: fear, anxiety, stress, happiness, excitement. To be honest, this was not something that I was aware of at all. Whether it was in vet school or upon graduating. So I've been working as a small animal veterinarian for 15 years. And in school, we did have a module or 2 on behavior, and it was very simple things, just simple concepts of the Pavlovian learning theory, and not too much else, to be honest. Perhaps the operant conditioning as well, and some aspects of desensitizing and counter conditioning, but that was pretty much it. Just kind of like maybe 2 weeks of behavior course, and that was pretty much my exposure to behavior. Fast forward 12 years later, so that would be 3 years ago, I became extremely passionate on behavior, and this had arisen from a case that happened in Singapore where a healthy 3-year-old dog was euthanized on the grounds of having behavioral issues. And this had come after, I believe, another case a few years back, maybe about 4 or 5 years back, where it was a similar case of a dog that had an absolutely healthy dog that had been euthanized because the dog was alleged to have aggressive tendencies. So this was something that really bothered me. And I went on full drive trying to figure out what was it that led to this. Was it something that could have been prevented from the onset? Or was it something that the industry as a whole, so different people and different stakeholders from the industry may have also inevitably contributed to this dog's behavior. And therein comes myself as a veterinarian. So if an animal comes into our clinic on an annual basis, at least for an annual health check, if not more, like if they fall sick or if they have some skin issues, then, why is the way that we handle the animal then also resulting in some behavioral tendencies. So this case where this dog was euthanized because of supposed aggressive issues really made me try to figure out, was there anything that we could do better as a profession, number one, to make the whole vet visit, less fearful for our pets? And also, how is it that we can set up their environment to contain less triggers? So we're trying to set up their home environment, set up their environments so that the dogs have more chances of success. So my interest in behavior and subsequently getting into the fear-free learning journey stage arose only about 3 years ago.
It's kind of a slow update, isn't it? Because we're trying to do the same thing with our dogs, our cats, or our pets, and we're technically trying to make it more comfortable for animals to be in, to get assessed or to go through treatment and stuff like that. But if you think about it, pediatricians have been doing it for 20, 30 years. They put, candy in the waiting room. They put toys in there to make the kids feel more comfortable.
Yeah.
And so I feel like it's about damn time, right? That we can make our animals feel comfortable as well.
It's very interesting that was one of the big triggers for you, because it's quite similar to us as well. Even just, I think it was 2 months ago, there was a similar case where a dog bit one of these owners and they called us in, and before we could even get started, they panicked and put the dog down.
Oh.
And it was absolutely devastating, to be honest. It's one of these things that I find very difficult to stomach, because they did the correct step. They called up and they initiated help. But before that help could even start, they found a vet that just put the dog down. That was only a couple of months ago. And then there's been so many of these in the past. And with what we know about canine behaviour and canine cognition nowadays, in my opinion, there is no reason for behavioural euthanasia at all. We know enough about how the dog's brains work that we can rehabilitate them. And it's very nice to hear, not just yourself, but to know that that's partly what this movement's moving towards as well. Because it's it's quite a dark topic, and it's one that hits a lot of people quite hard.
From my perspective, initially my passion was driven by the fact that I just felt that, the veterinarian that was involved in this case did not really present all the options possible for the owners. One very important one was to reach out back to the animal welfare group that had adopted, that had given the dog to those set of owners. So, and then when I figured that actually it's beyond that as well. It's not just how the veterinarians should have been improved, but then if we take a step back and think of what else encompasses the dog's life. So we have training, we have day-to-day care, veterinary care, grooming care, husbandry. Right from the start, the dog was acquired and entered to that household at 5 months of age. What could have been done better? How could dog have been set up for success all right through their lives? Because I think what happens, and similar to what you just mentioned in the recent case, people tend to be very reactive. So a problem arises and then they jump on it, and then they panic and they try to find the quick fix solution. And in the case that you talked about, the quick fix solution was to get rid of the dog permanently. But what could we have done better right from the onset of getting the dog? How could we have trained the dog in the a positive reward-based method? How is it that we could have practice certain care techniques of the dog to prepare the dog for being handled by strangers in future, and also recognizing that not all dogs want to be handled. I mean, I like to tell my clients, when they come in and say, my dog's so antisocial, my dog does not like to meet other dogs, just keeps on barking. And then sometimes I'll just kind of inject a little bit of similar to how we are. Not all of us are extroverted. Not all of us want to go up there and shake hands and high five, So similarly, right? Some days we've got good days where we feel like we want to interact more, and some days we just feel a little bit retreated. And we need to respect that animals have that emotional spectrum as well. And I think it's all about education, which unfortunately right now is lacking. So, yeah.
I mean, if not for work, I don't even want to leave the house. So I completely understand what you're saying.
Yeah.
No, this is not something that I was actually planning on talking about, but it's very, very in line with what I'm seeing as well. And one of the biggest things I've noticed is, even with animal welfare groups, a lot of them they've got great hearts, they've got great intentions, but obviously their aim is to rehome as many dogs as they can. I must say, some of the animal groups are awesome. But now and again, you get these situations where they set the dog up for failure based on where the dog is going. And that could be solved a lot just by the education of the potential adopters, the people handling the adoption cases, all of that stuff. And it's things that we are actually looking to try and help with as well, because not everybody wants to go to a centre or a classroom to do this. So if there was more online courses for things like that, I think it would be a big benefit to the whole system. So I completely agree with everything that you're saying there. The other thing as well is that there's a certain aspect of pride, and a lot of the time people don't want to lose face, to use a more sort of Singapore term. They want to keep the ego going, and as a result, they will be more willing to put the animal in harm's way rather than lose that ego, which is heartbreaking to see. And I'm really, really happy to hear you talking about the fact that some dogs don't like to be handled. I mean, when I bring Athos into the vet, and Athos is a big, gentle dude now. Contrary to anybody that's binge listening the podcast, I know you may have just listened to the first episode about Athos, but rest assured, he's very gentle nowadays. But when I take him to the vet, I have to be the one to help handle him. I can't hand him over to a vet tech. He's not going to do anything to them, but he's not going to let them draw blood. He's not going to let them, check under his tongue. He wants somebody he trusts helping at the same time. And there's nothing wrong with that.
Definitely.
Just to touch on the behavior side of things, I think that, Faisal, you'll probably agree with me on this as well. As a trainer in Singapore, as a behavioral trainer in Singapore, one of the main issues I get the most is that a lot of the times the owners wait till there's a problem before they engage us. And then because of that, like, the problem's already stemmed or rooted in so deep that it becomes more difficult to rehabilitate or to train the dog out of it or to counter condition the dog out of it, that some people just feel like, you know what, I don't want to put in this amount of effort for that. But it could be solved very easily if you started earlier. Like, you don't have to start from day one, but like as soon as possible kind of thing,
So within what you're doing, if you had a magic wand and you could just sort of say, this is what's going to happen in the future, what would you want to see happening?
Okay. So very interestingly, so the fear-free movement started in about 2016 in the US. To date, I think, if I counted correctly, there are 15 of us vets out of 490 listed in the Singapore list. I mean, I'm not sure if all of them are practicing, but it gives you quite a good idea of the very small proportion of veterinarians who have been fear-free certified. So I would like to think that, yes, they perhaps know a little bit about it, but maybe just haven't gone the extra step to embark on the learning journey. But what is encouraging is that our local veterinary technician diploma course run by Temasek Poly actually requires that all of their graduates be fear-free certified. I actually wanted to go in to conduct a couple of modules on teaching, handling, etc. But they said, oh, we've got this all sorted. One of the prerequisites is that they want their graduates to be fear-free certified. So that's wonderful. However, I'm thinking that yes, you can most certainly have the support team thinking the right way, doing the right thing, but ultimately you need the vets to also come on board, because if you've got vets heading the clinic, you can have the support team saying, this is what I think should be done, but how often does your voice get heard? I had a magic wand. I would love for all veterinarians to go through this. That's one. And just to let your listeners out there know, fear-free also is extended to other aspects of the pet industry. So you've got your dog trainers, you've got a fear-free certified dog trainer program, you've got a fear-free certified shelter program, home boarder, pet sitter program. You also have a website which is free accessible to all pet owners. So all you need to do is just click on the Fear-Free Happy Homes website, which I rephrase you would put on the podcast notes after, and check it out, because it's got so much good information out there. Even something as simple as feeding your dog. If I were to just give a very simple example, what it would be the traditional way of feeding your dog. You scoop up their food, you put it in a bowl, you put it in front of them, and then that's it, right? But there is so much. There is a much better way that you can feed the dog. Yes, and if you're in a rush, you may need the bowl method. But really, there is other alternatives where we're actually trying to allow the animal to use their minds, use their 5 senses. So you can put them in snuffle mats, in Kongs, in feeding toys. You don't even have to buy them. You can make them on your own. Mineral towels, let's say, towels that are rolled up, and you put kibbles inside. You roll them and you knot them up. Just things like that. It's very simple things that you can keep the dog engaged. So you can move from a complaint of saying, oh, my dog finishes his food in 5 minutes. He's looking at me. He's counter surfing, trying to take my breakfast. Well, if you tried a different way, and if you gave them something that could last a lot longer, that counter surfing may happen less. But of course, we're going to have to adjust other things as well. But this is just one small and simple example.
That's a fantastic example, actually, because this is something we talk about quite a lot as well. I remember the first time I heard about it, and it was years ago when I was working with one of my first mentors, Dr. Tom Mitchell. And he calls it the ditch the bowl movement. And such a simple thing that people don't think about. And it does so much for your dog. You're talking about hitting their mental activity requirements for the day. You're talking about slowing them down so they've got a healthier intake and diet. You can even talk about giving them bigger range of food, because obviously if you just give them tinned canned food, it's quite difficult to play scent games with soft wet food, so you're going to have more of a varied diet. And there's just so much benefits from doing something so simple, yet it can have so much of an impact on your bond, your dog's ability to be more optimistic, to be better socialized. That's a fantastic example, actually. I like that. Now, just to go a little bit deeper into what it actually means, if you were to tell us, what does being fear-free actually mean for the professionals and the owners, and what's the difference between like traditional veterinary care and fear-free veterinary care?
I guess the aim ultimately is to try to ensure that the animal that comes through the veterinary clinic experiences as little fear, anxiety, and stress as possible. So there are 3 markers that we look at. So dogs and cats both show different body language of signs of when they're having and experiencing fear, when they're feeling anxious, and when they're experiencing stress as well. So understanding, number one, their body language, more fearful, more anxious, more stressed, and starting this not just from the time that they enter the vet clinic, but also in the preparation of coming to the clinic. So how is it that we can prepare our animals for the veterinary visit in a less stressful manner? This terminology is fear-free. I think it would be quite difficult to actually achieve zero fear altogether, but I would focus on it being as fearless as possible. So starting from the visit to the clinic, getting into the car, are we putting our pets roughly into their crate for a cat, or are we acclimatizing them to their carrier so that they would naturally walk in because the carrier is a familiar item in the house? So do we take this cage out only when it's time for a vet visit? So that would already set the cat up to feel anxious. Why is this carrier out? So one thing I tell my clients is what sort of carrier to buy. Something that has a lid you can open from the top so that the cat can pop his head out and jump out as he wants to. And it must have a gate in the front as well. So we avoid pulling the cat out. So if I were to use a cat as an example, the cat should be in a carrier that they're familiar with. When they get into the clinic, for cats that do have very obvious signs of fear, anxiety, and stress, I would also recommend to put them in a time slot where there are few animals in there. So either the first slot of the day, my first one after my lunch hour, or the last appointment of the day. So we reserve these slots for pets who need extra time, extra space, and a clean smelling environment. It shouldn't be an environment where it's, smelling of many different animals. And then coming into the clinic, the waiting time also should be sometimes minimized, sometimes extended. It really depends on the patient. So I do have some dog clients, for example, where the longer they are exploring the grounds outside my clinic, the more relaxed they become, as opposed to whisking them in, putting them straight on the table and just getting the job done. And then we also do have a small subset where the faster you get things done, they're much happier to be out of the clinic. So we need to also know our patient well. So a traditional handling would involve a lot of restraint, perhaps some force. So let's just take an example of a blood draw. Your dog Athos would not let a vet tech or vet techs handle him. What would be less stressful for him would be Fraser being there, being his emotional pillar of strength. And then perhaps, correct me if I'm wrong, but if a vet tech then came in to hold the vein, or maybe you might be equipped to hold the vein, and then the vet puts the needle in subsequently after a few touches with the cotton ball, with a little bit of alcohol, just to let Athos get used to what that might feel like. So then that moves away from the traditional handling of just brute strength and force to something where we are aware that Athos may not like handling by strangers. So let's see how can we make this less stressful for him. Also, I think recognizing that there are some cases where for safety reasons, we do need to do what we call gentle control. The sound of needing to use a muzzle in a lot of people's heads that the animal is aggressive, is dangerous. But really, a muzzle is a form of gentle control. If you choose a correct muzzle, this muzzle will allow the dog to breathe. Sometimes you can even feed food through the muzzle if the dog is food motivated. And as long as the dog also has been introduced to the muzzle prior to the vet visit, if everything comes as a surprise, then what do we expect? If somebody were to tape my mouth, I would rip that off immediately. So likewise for a dog, we want to be able to acclimatize the dog prior to the vet visit. So a lot of it isn't just what goes on in the clinic, but a lot of it happens out of the clinic before consult. And I do have cases where, people come and look for me because they know that I am fear-free certified. And I'm very upfront. Sometimes I tell them that the first visit, we may actually not do anything. So obviously the patients come in for what we call victory-friendly visits are those that do not need immediate veterinary care. So they come in with the owner's bags of treats, loose leash, and, we've got all our enrichment tools out there, our feeding tools with snuffle mats, my snuffle balls and things like that, my licky pads. And what do? I spend a lot of time talking to the owners. The dogs finally warm up a little bit. They move away from being close to their owners, and they eventually, maybe after 30 minutes, might come a few steps closer. So I think that's victory. And then we work and hope that the following vet visits would be less intimidating.
So just for the record, you're absolutely spot on about ethos. Effectively, as long as my wife or I are touching him, then you can pretty much do what you want. There was a big thing that you hit on there, which I was wanting to talk about a little bit later, but now's as good a time as any. Preparing the dog for going to the vet is something that is so neglected. In fact, just not so long ago, we did a seminar on that as well, because it was something that was just, people were asking a lot about it. It was just amazing how many people had such a negative connotation of a muzzle. And I know we've spoken about this in past episodes, but I always think to myself that even down to the stage of, if you had a person that you couldn't talk to, so they didn't speak the same language and they didn't understand what a doctor was, and they broke their arm, do you honestly expect them not to try and hit the person who's handling that broken bone? So like, having your dog muzzle trained has got nothing to do with the dog being aggressive. It's a safety factor for everybody involved. I just thought it's a very, very potent point, which, again, no surprise, is all about education. Interestingly enough, when you started talking about ethos, he started coming back into the office there.
It's similar to my goals, right? I've shaped muzzles for them. I've shaped bringing them to the vet. I made sure it's a very fun and exciting thing. We've been to the vet a couple of times whereby we actually didn't go there for an appointment. We just went there to ensure like they get comfortable with the place and stuff like that. Now if I tell them we're going to the vet, they see it like as a trip to the beach or something like that. They get really excited. They start to jump into the car, and then they're the ones pulling me into the vet instead of the other way around.
Yeah, that's a good sign.
So, I mean, all of that sounds amazing, and I really appreciate the fact that you went into some good detail about how you shape your scheduling in the office and the clinic waiting room and things like that. I think that's things that a lot of people don't even think about when they think about taking their animals to the vet. So just because you are fear-free certified, how do you ensure that everybody else working in the clinic is on the same wavelength and doing the same working style and ethical beliefs as you do?
So I think for a start, I would definitely want to make it a prerequisite for the vet technicians, the vet nurses to also start and embark on the fear-free learning journey. So there is a fear-free veterinary technician chapter as well, which the nurses can enroll themselves onto. And I think, the whole program in itself is extremely enlightening. Once you start on the journey and you realize that there's potentially so many other areas of improvements that we can make in ensuring that clients and their pets who come into the clinic have as fear-free an experience as possible, the mindset would naturally be steered that way. I mean, that's how I would like to think it. I was really moved and a little bit emotional, I'll be honest, when I started doing the course, and it made me want to continue because there's so many different modules and chapters. Sometimes you can lose steam, but the way that the whole fear-free concept has been developed really makes me understand that there's so much more that we can do to ensure that clients and their pets actually want to come through the doors, to give them what is necessary, an annual health check. So, starting from the veterinary receptionist, being able to know how to assess the dog or cat's body language. So, a vet receptionist who may not understand dog behavior or cat behavior may just reach out her hand and attempt to pat a dog. But if also recognize that the dog is showing signs of anxiousness or being shy, you wouldn't do that. So I think it's very important right from the start of the meet and greet protocol all the way to the veterinary checkup, as well as the vet tech handling. Yes, I think it's extremely important that the whole clinic is on board and understands the important concepts of fear-free. Do
you have updated trainings and things like that? Do you invite people in to do like seminars and courses for your staff to keep them updated with everything?
I would be sort of identifying areas where I think we should focus on. Even something like a case like ear cleaning. So an ear cleaning service, how do we make as fear-free as possible? So it starts from so we don't, the traditional method might be you just put the animal on the table, get your cotton balls ready, and pour the liquid in there. So there's no introduction to the process. The difference then with fear-free would be that you would want to pair the ear cleaning process with food if the animal is food motivated, and also just the sight of the ear cleaning bottle. Some of the pets may shy away from that and check that the smell of it means that the ear cleaning process is going to take place. So yes, in reality, is it possible to have an animal completely without fear during an ear cleaning process? I think the answer is no, but we can most certainly try our best to make the experience as low stress as possible. And I would also teach clients, again, this would be part of the preparation for the vet visit, on how to do simple handling techniques at home. So I love to tell my clients to role play, especially with, families that come in. So I'll say, mom could be the owner and the daughter could play vet. How we do that, we can get the mom to station the pet, and the daughter would then come in and do your gentle touch. You could even mimic the stethoscope going on the chest, touching the legs. So that's something that I try to get my clients to be on board with. Stationing, positioning, to get their animals used to how we would touch them from head to toe. Yeah.
Sorry, I don't mean to be giggling there. I'm laughing because Freya got a doctor's kit and had a stethoscope, and she was putting it in all the dogs, and she went up to Aramis and she put it onto him and she went, "Oh, fast."
That's cute.
So yeah, that's why I was giggling there. I wasn't laughing at it. It's a very good point. I didn't even think about that. Although Freya, for the listeners, that's my daughter, not one of the dogs. Although she was doing that as part of just play, it's a very good point for shaping the vets as well, because as much as I talk about getting people ready for that, I've never actually thought about saying to them to role play. And that's a really good way of doing it, especially if you've got family.
One burning question that a lot of people have after listening to, learning more about fear-free vet, fear-free pet professionals, will it be more expensive then?
Yeah, I think if I'm not mistaken, like in the US and in other countries, fear-free certified vets do actually charge a higher consultation price. And I think the justification for that is that there is more time spent during the consultation. So, a regular 15-minute consultation may take 30 minutes to 45 minutes because you're trying to get the dog or cat acclimatized. You're chatting with the owner, just trying to make the environment a little bit less stressful for the pet. So time-wise, yes. And also the resources that one may need. You would be potentially providing food rewards. I think it would be fair to say that a fear-free certified vet might feel inclined to charge more, and I think that's what they do in other countries. But I'm not familiar with what some of the other fear-free certified vets do in Singapore. But in my clinic, the consultation costs are the same. Definitely
will cost more, but in the long run, it'll cost less. That kind of thing.
Yeah.
Because like you said, right? So sometimes the dog comes in and the dogs are so scared, so stressed, so anxious. You might not be able to do anything. But a traditional vet would take out all the restraints and then pin them down and then just do what they have to just to, get it over and done with.
Yeah. Fear-free certification also acknowledges and recognizes that there are some animals, I think in your questions, what if an animal just really cannot be touched, right? So I think what is paramount is the animal's welfare, the people's welfare, the people who are handling the animals, so the owner, the veterinarian, the support team. So I think we also need to be mindful that safety is very important. So in the instance where we do have an animal that is either not willing to eat anything, take any food, or is not amenable to gentle restraint, gentle control, then sometimes what we do have to talk to owners about is the need to use pharmaceuticals. And these would be, there are two types. One would be what we call the pre-visit nutraceuticals. So you've got that in the range of supplements like your L-tryptophan. And then you also have other pharmaceutical drugs that can be given prior to the vet visit. So calming medications that are available, and we would want clients to speak to their vets about that. So there are calming medications that can be given 2 to 3 hours prior to the vet visit. And I've used this in some of the dogs with great success. So what happens is that I would dispense these, with the knowledge. So I would have the animal and the client come in. We would have assessed that the dog may not be amenable to touching, but we're not going to rush to do anything on that visit. So what I will then do is I will dispense some pharmaceuticals to give to the clients for them to be administered 2 to 3 hours prior to the next vet visit. And during that time between that first visit and the next one, they are meant to assess and determine if those pharmaceuticals work. So what they would do is they would give it to the dog at home. They would observe whether the medicines had any effect on the dog and how long the effect was and what the effect was as well. And then from there, we might start to tweak it, or if we think that that's a good dose, the animals would then come in for their next visit with those medications already taken 2 to 3 hours prior. So sometimes that alone is good enough. And in some other cases where, yes, that might take the edge off the animal to a certain extent. But if a procedure needed to be done where, more restraint was needed, then sometimes we do have to talk about sedation. So sedation, just as with muzzling, should not be viewed in a negative way. We only use it if we really have to use it. And the good thing of having the pre-visit pharmaceuticals on board is that when the animal then comes into the clinic, the amount of sedatives that need to be used is much lesser as well. So everything is reduced, So that was something that I felt that the viewers should know, that, if you do end up having a pet that really is not amenable to any handling, but yet a veterinary attention or check is essential. It is important to talk about this to your vet as well. A free certified vet will also know how to differentiate between what is a need and what is a want during a physical examination. So yes, you may want to check the dog's temperature, but checking the dog's temperature involves lifting up the tail, poking a thermometer into the anus. The dog is bouncing off the walls, very bright and alert. What is the chances that the dog has a fever? Probably very low, right? A very low chance that the dog has a fever. So the once, you want to check the dog's temperature, but is that really something necessary? And is it something that you have to do at that visit? I think that's also something that a fear-free certified vet knows how to identify and differentiate, determine what is important and what is essential.
There's also like a scale or something, right? Like, because you have to put the health and the safety of the animal first. A while back when my girls had got into a fight, right? And so they had like a puncture wound and the ears and stuff like that. They had to be sedated so that the wounds could be flushed and cleaned to not get infections and stuff like that.
Yeah, that's right. So sedating actually is, again, like muzzling, shouldn't be viewed as something that you do only for dangerous dogs. So Jay gave a very good example. I mean, when you've just been in a fight, I think even in humans, right? If you've been in a motor vehicle accident, and they often sedate the person just so that that in itself also helps to take care of some pain that they may be experiencing.
Like we automatically draw ourselves towards being quite dog heavy on this podcast, which is not something I want to do deliberately. Because I grew up on farms. I've grown up with lots of different animals, and I love cats, I love birds, and I've had a lot of these guys growing up. But it's just that I only have dogs at the moment because we live in a condo, and I don't really want to have a cat in a condo, to be honest. Not that there's anything wrong for anybody that does have that. I always feel that things like sedation and keeping cats safe and keeping like parrots safe, because these guys can also give nasty bites and hurt themselves in the process of flailing about. So, I mean, I was going to ask about keeping the animals and staff safe without doing forceful restraint, but you've answered that absolutely beautifully there. Could I just ask, though, could you give an example about maybe a different animal and how you would deal with the likes of, say, a parrot or a cat who might be a little bit more inclined to flail around even under mild sedation? Do you just have to go full on sedation, or do you use things like wraps or anything at all, or is that completely out with the fear-free way of doing things?
No, not at all. So a wrap or towel is actually classified as a gentle control method. So there is a technique where you can actually wrap a cat kind of like a scarf, or, a thick towel, which kind of acts like a scarf around the cat's head. And if the cat is food motivated, I've done blood draws with the cat in the sphinx sort of position with the leg out, and the cat is licking on a tongue depressor that is filled with treats. So it is possible. I mean, I have definitely observed that there are some cats that like a certain position more than others. So I think you would definitely have fewer cats that like forceful restraint, for sure. So forceful restraint and restraint where they don't have a choice would involve lying on their side, versus one where you are utilizing them being in their natural position. So the sphinx position, and you just extend their arm lightly, and you can collect blood as well. And I think a lot of it also does require some cooperation from the owners. So I like to tell the owners what to expect, what I plan to do, kind of walking them through the steps right from the start. So I mean, just give a little example. This stuck in my head quite vividly at the start of me embarking on the fear-free journey. There was a dog that had come in for a review of his castration wound. And the dog had been licking on the wound because the owner didn't place the cone on. So naturally, the wound got infected. And with an infected wound, you do feel pain. That area was swollen and it was red. And so the dog was obviously very clingy to the owner. So he didn't want any of us to handle him, both because that was his personality and also because he was in pain. And this owner just didn't want to have anything to do with the dog. So he stepped back and he was like, "No, I'm here. And I expect that your vet nurses come and handle him." And I was like, "Oh, but it's pretty obvious that he's trying to hold on to your arm so that he can get some comfort from you." And I insisted he do that, because the minute the vet team, we didn't even go very close to him, he would already be growling and he was baring teeth. So the owners then said, okay, he held the dog. And the minute he did, the dog was really calm and relaxed. I'm not sure why sometimes it there's a bit of a mindset that, when you step into the vet clinic, you just allow the animal to be shipped off to back, just let the vet tech team handle it, and then you just leave the clinic subsequently. So sometimes we want to try to educate owners that at the end of the day, your pets feel these emotions, they've got these needs. Let's just take a step back and see, is it something that I can help them with or not? Yeah.
What an absolute dick. Like, like what the hell, man?
Oh, Jay, you'll like to know he then gave me a really bad review on Google as well.
Oh, piss
and then
off.
and then he was like, "Oh, don't come into this clinic because they won't touch your dog." That was just so not the story.
What the hell? Like,
But yeah,
oh my
that just
God.
told.
It's so the number of vets that I've gone to and they've been like, "Oh no, just leave your dog with us. We'll deal with everything." And I've always been like, "No." I mean, to be honest, slight little story. The reason I never liked that is because when I was 16, I rescued a kitten that was hit by a car, nursed the kitten back to health. She grew into a little cat and it was time for her to get spayed. She went into the vet and the vet was like, "Don't worry, I'll deal with her." Took her into the back and then I got a phone call an hour later saying she'd passed away from an overdose on anesthesia. So I'm super paranoid about leaving my animals with the vet.
Like I know it's procedure for vets and clinics, and like if you have to put your dog or your pet under sedation, right? They have to like sign the form or something like that. Yeah, that still freaks me out till today because like I will read through it, right? I'll read every word of it, and then there's that part that's like, do you want to resuscitate or do not resuscitate kind of thing. And and the first time I saw that, I completely freaked out. Like my dogs were not anxious, were not stressed at all, but I was.
I mean, as much as we're making light of that, I think one of the reasons is that there are so many vets that do say to the pet owners, "Just leave them with us. You can go away and have a coffee, come back in an hour," or whatever. So it kind of sets a tone, which has a big differentiation between what you do versus what the more traditional vet care does. So as much as that guy was being a bit of a dick, he probably was shaped by the history of going to other vets, don't you think?
Yeah, definitely. Yeah.
I think that plays a small part. I think you're being too nice, Fraser, honestly.
Well, I'm not too nice often, but when I am, I try to be. It does lead me to one other question, which I was wanting to ask earlier, but I missed my opportunity. When you've got new clients coming in, do you have like a pre-consultation form so that you can find out more about the animal's behavior before they come in? So almost like pre-set questions. Yeah.
There is a questionnaire which allows us to understand a little bit more about them, about their pets, the history. So starting from the very beginning of where did they get their pets from, because that can also tell us a little bit more about the pet's personality potentially, and quirks, dislikes, triggers, what their favorite treats are, whether they like car rides, whether it makes them sick. Definitely. There's a pre-visit questionnaire that we would want the owners to fill up first. So it gives us an idea. And one of the parts that also says, does your animal dislike handling? That gives us some idea on how then we would sort of design to have that consultation pan out. I have had consultations where, people have filled up in the questionnaire. My dog refuses to walk through the vet clinic. So I do consult outdoors as well, out on the grass patch.
Oh, get a bar or something?
Oh yeah, if only, no.
Would pay for
that. I've got a lovely grass patch outside my clinic. There's like 2 pavilions, where people can just hang out, and it's a good spot because it allows the dogs to see the clinic. You can give them a treat. They look at the clinic, they see me walking out, they can get a treat, that sort of thing, and then ultimately we might do the consult outside. So
okay, so we've come to the question portion of our podcast. It's near the end, but these are some of the questions that our listeners sent in, and the first one comes from Liz in Melbourne. How do you know you have chosen a fear-free vet?
There is a listing out on the website, which we can put in the podcast notes, where you can search for a fear-free certified practice or a fear-free certified professional. And within that professional, you've got your subheadings of your your dog trainer, pet sitter, and you can also put in the location you're in. So if it's Melbourne, you can put in your postal code and a list of the professionals near you within, I think they put, you can either put it in the number of miles radius. It will come up with a list of people that are fear-free certified. So only people that have completed the fear-free certification program and are continually doing their continuing education on an annual basis will be listed in the directory.
Okay, the next one's from Fiona in Hong Kong. It's not really fear-free based, although I would say, well, the question is, my cat keeps scratching my toddler. Should I declaw my cat? What can I do about this? So I'm just going to jump in a little bit first, because if the cat is scratching the toddler, there is a fear basis to that, because the cat's not going to be doing that for no reason. So it'd be looking at how you can make your home more fear-free for your cat. But I'll let you carry on with that one. I just wanted to get that little bit in there.
There has to be a trigger as to why the cat is swiping and clawing at the toddler. So we would want to ensure that the toddler and the cat perhaps is they are in safe distances from each other, and that the cat also has the opportunity to retreat away if the cat feels that, it is being antagonized or provoked. So declawing would not be a recommended option. So like in Singapore, declawing is illegal. I'm not sure what the rules are in Hong Kong. But declawing is considered an inhumane practice because it actually results in pain. You can get severe infections of the tissues, and you can get residual pain in the paw where the claw digits have been removed. So it's definitely considered an inhumane practice. So I'm sure we can find out other solutions on how we can ensure that your cat would stop clawing your toddler first.
I mean, on top of the actual environment and making it more fear-free for the cat, there's definitely bonding exercises and desensitization exercises that I would advise for the cat and the toddler. And of course, as difficult as this is, and I do appreciate how difficult it is, educating the toddler on how to be around animals is very, very important.
So we got the last one here. Comes from Elena in Jakarta. How many times should I let my dog throw up before bringing them to the vet?
Whenever in doubt, my recommendation would be to just bring your pet to the vet clinic. If you're not sure whether the symptom of vomiting is a sign of something more serious. In general, if the animal is still looking bright, alert, doesn't look depressed, or is still exhibiting normal behavior, you could opt to monitor within a 24-hour period. If the vomiting persists and the animal looks lethargic, looks depressed, not moving much, not wanting to eat, then I think it would be prudent to bring your pet to the vet clinic earlier than later.
I just want to give you a big thank you for coming on. We'll obviously put everything into the show notes, but what's the easiest way for people to find you or to find out about the fear-free certifications?
Yeah, I can put my Instagram handle up.
Okay, great. Well, we'll put all of that into the show notes. And again, thank you very much. And we hope to have you on again.
Thank you.
You're up for it.
Yes, it was a pleasure talking to both of you. Thank you very much.